nutritional benefits that you can do for yourself, and you'll slow down your aging process.
The answer to that question is this country ranks 54th in terms of longevity, meaning there are 53 countries living longer than we do.
Hello and welcome to Prestege Wellness Podcast. To my right, I have Dr. Slavin, functional medicine doctor and researcher, and to my left, Dr. Preste, internal medicine doctor. Thank you so much and enjoy the podcast.
Well, thank you, Eve, for that very nice introduction. We at Prestege Wellness, located on the east side of Fort Lauderdale, are very happy to introduce today to you Dr. Slavin. Herbert Slavin has been with us for about 3 months in a collaborative relationship, and we are very, very excited about the potential of him coming and being with us at Prestege Wellness. He adds a great sophistication of knowledge about age reversal, about health and difficult problems that people have and sometimes run out of options in the traditional allopathic arena. Dr. Slavin will take those patients who really have no other hopeful options and give them hope, and sometimes get some very, very nice results for people who have exhausted what they can produce for themselves in the general medical arena. We're very, very happy to be here today introducing Dr. Herbert Slavin and having a dialogue about wellness and what we feel are the exciting things that we can offer for today's community on the east side and west side of Broward County. Dr. Slavin.
Thank you, Dr. Preste. I'd like to preface our conversation today with a very important fact. If you were to evaluate how effective healthcare is in this country, I think the one statistic you want to know is where we stand in terms of longevity. And the answer to that question is this country ranks 54th in terms of longevity, meaning there are 53 countries living longer than we do. Yet we spend the most money on healthcare than any other country. We spend the most money on drugs, on surgery, you name it, we spend the most money. But what do we have to show for it? So that's why it's important to look for an alternative approach, because the approach we're using now really doesn't take us to where we want to be.
There are so many parts to what Dr. Slavin has just suggested, and it was a very, very nice introduction. And it really states where we are in this most advanced country in the world as far as healthcare research, and where we are as far as healthcare delivery. And those are two separate items. We're number one in the world in research in many arenas, and there are other countries that are also number one in other arenas of medical research. But what happens is between the research and clinical implication and implementation, corporate world has come in and is just taking so much advantage. And that's why it's so wonderful to be part of a great wellness center offering other advances, how you can do age reversal for yourself. You can live longer by controlling your diabetes, your type 2 diabetes. And in fact, type 2 diabetes is really a reversible entity. If you have type 2 diabetes, you can come and see us, and we can offer you programs that will guarantee your type 2 reversal, or we can do our own programs for you and start you on that recovery of your insulin receptors and your insulin resistance, and get you back to a normal glycemic control where your body is oxidizing itself at a lower rate, you're aging at a much lower rate. When your sugars are down, your whole body is functioning better, and all the necessary cellular metabolisms that are necessary, including gene repair, which is so important and has been related to very, very recent mice and age reversal through certain clinical research products that are being given to mice and showing they can actually reverse the aging process. Very, very exciting work. So, Dr. Slavin, as far as, we are a wellness center. People do come and visit us, and we offer suggestions. Some of the suggestions we offer are in our protocol before we even meet them. And sometimes, there are metformin, for example, might be one of the first age reversal FDA-approved medications. Metformin being used for diabetes, and a very somewhat safe drug. And people are taking metformin for age reversal. It's something that we suggest at Prestege Wellness, but it's certainly not our first. But it is one of the first things we think about as far as nutritional suggestions and what you can do in today's world as far as obesity and all of the attendant problems of hypertension, diabetes, heart disease, and inflammation of the body, oxidation of the body, and all those things that we can slow down the oxidation process, which oxidation, loss of electrons, rust. When you oxidize metal, it's rust. When you oxidize the body, it's aging. Slow down the oxidation process through different nutritional benefits that you can do for yourself, and you'll slow down your aging process. And the reason Dr. Slavin and I are here right now to talk to you about slowing down the aging process is because if you can slow it down, that means you'll have less disease as you grow older by better containment of your health presently. So we are a wellness center that promotes good nutrition. You have to have good nutrition to start any benefit for your body. And then you have to have necessary sleep. You have to have necessary exercise. And the rest we can help you with. If you're having problems with anxiety and stress, there are things that you can do, including what some people in the world of age reversal, they feel maybe one of the first nutritionals that you should be on is N-acetylcysteine, NAC, because there's so many benefits to being on NAC, basically a semi-essential amino acid. And if you're low on NAC, it can cause a number of problems. And it's also for toxicity, NAC. I've given many, many doses of NAC in the intensive care unit. It's a mucolytic, among many other things that it does at cellular level. It's a mucolytic that actually decreases the sulfur tension in mucus. And by decreasing that bond of sulfa, you cause the secretions, which are heavy in COPD, emphysema, chronic bronchitis, and other lung problems. And by cutting that viscosity of the mucus, it's more easily removed out of the lungs with less coughing. And with hydration, it's one of the best ways to remove that chronic mucus that builds up in COPD. And for that reason, it's one of my top suggestions for the general audience for NAC as a supplement. Usually it's 600 milligrams twice or 3 times a day. And there are many, many other benefits that we'll maybe look into. And if you're interested, come and see us at Prestege Wellness, and we'll get you in the right direction. So, Dr. Slavin, as far as what I just suggested, top nutritionals, what are some of the things that you like to do for your patients when they come to see you?
Well, the first thing is, sometimes I'm asked, what's the most important supplement? And the answer is the one you're lacking. Because everybody's different, but I can tell you that what most people are lacking, when you can measure it for, because NAC is not readily available to measure that level.
Correct.
But one that you can measure easily is your red blood cell magnesium, frequently deficient. Vitamin D, unless you're taking a supplement, you're going to be deficient. And you can't go by the level of tan you have. I've had people with dark tans with low vitamin D levels. Vitamin C, particularly important, because here's a fact that most people don't realize. Most mammals make their own vitamin C. There are only 4 mammals that don't: humans, primates, the fruit-eating bat, and guinea pigs. And that's why they use guinea pigs for experiments, because they are similar to the humans in that they don't make vitamin C. And Linus Pauling did the important research in this area. And he concluded that based on a human's weight, we should be taking at least 2,000 milligrams of vitamin C a day. In animals, when they get sick, they increase their production of vitamin C. Now, why is vitamin C so important? For a couple of reasons. One is it's a precursor to collagen production and also cartilage production. So sometimes I think to myself, since people are routinely deficient in vitamin C, maybe that's behind all these hip and knee replacements we're doing, because they're wearing out their cartilage and they don't have the vitamin C in their bodies to help replace it. Now, when it comes to collagen production, collagen is what gives strength to every part of your body. A severe form of collagen deficiency is called scurvy, where you don't have enough vitamin C and your body can't make collagen, and basically your body falls apart. Now, this is also Linus Pauling's theory, which I tend to agree with. The cause of coronary artery disease is a lack of vitamin C, and that lack of vitamin C leading to a lack of collagen weakens the coronary arteries, predisposing them to injury due to the pumping action of the heart. And then the body puts down plaque to cover that. So it's not the high cholesterol that causes the plaque, it's the damage to the artery that the body wants to prevent. And if high cholesterol was the issue, then all my patients with cholesterols over 300 should have coronary artery disease, and they don't. And I test them. There's a test you can do. It's called the coronary artery calcium score, to give you an indication just how much plaque you have. And many of them with high cholesterols have 0 plaque. And that was shown in a book called Cholesterol Myths by Uwe Ravsnikov. He looked at all the studies on cholesterol, and the conclusion he came to was that cholesterol is associated with coronary artery disease in half the patients. And then the other half with low cholesterol also had coronary artery disease. So the link is not the cholesterol.
This always is fascinating. And we still don't know what to do for a patient who has a high calcium score. And it's very, very interesting that you bring this up, because this is a hot item right now in the United States and throughout the world, because this leads to virtual arteriograms and determining if a person, it could be that person at the age of 50s, 60s, 70s that have no idea that they're about ready to be taken out of their family because of coronary artery disease and myocardial infarctions and sudden death, and in their 50s, 60s, and 70s. And by having a simple calcium score, you can determine if you have a problem or you don't. And if you have a score greater than 300-400, then you need further evidence that you're not going to have a heart attack. Cardiologists, there's not enough cardiologists in this country to treat all the problems of coronary artery disease. And so, find out, determine your calcium score, and make sure you're not leaving your family because of coronary artery disease that you didn't even know about. So thank you, Dr. Slavin. That's a great, great suggestion. And there's so much going on in radiology and those services about determining vascular compromises in your carotid arteries, in different arteries of the lower extremity, causing need for amputation, kidney disease, etc. So we are early on in how to get rid of plaque. It's interesting because there is no real good treatment that I know of to remove coronary artery calcification once it's there. Sometimes I hear about reports about severe weight loss or prolonged calorie restriction, but I don't know of any good research that shows that it did reverse your calcifications of your arteries. Any thoughts there? I know we used to, somebody have high calcification of their coronary arteries. We put them on EDTA, ethylene diamine tetracetic acid, to bind the calcium and hopefully reverse it. And I think people were saying they were feeling better and doing better, but I don't know where the research is. Do you know where that is presently?
Well, that treatment it didn't start off that way. It started off treating lead toxicity.
Yeah.
And that goes back to the 1940s. So these were military personnel that were exposed to lead from paint. And they treated them, and that treatment is still acknowledged today as the gold standard for lead toxicity, EDTA chelation therapy. And they treated their lead toxicity. And some of them who had been suffering from coronary artery disease in the terms of experiencing chest pain with exertion, their symptoms got better. So one astute observer said maybe there's a connection between the treatment for lead poisoning and the relief of their symptoms. And they repeated the study on a group of people, and basically the protocol is about 30 treatments over a 15 to 30 week period. But after 30 weeks, they didn't notice any improvement. But then they went back and called up those people about a year later, and most of them got improvement. In other words, the improvement isn't immediate. It takes time for the body to repair itself. Now, so that's an important treatment to be aware of. Now, the reason it disappeared, it coincided with the invention of the heart-lung bypass machine. That enabled doctors to go in and do bypass surgery. And the way that story developed was, before they started doing bypass surgery, they were repairing all these valves that they couldn't repair before because they didn't have that machine. Well, they got all the valves taken care of, and now they had to think of, what can we do next? We've got this machine here, now we've got to look for an operation to do. And that's what they came up with, a bypass operation. Now, studies show the bypass operation will improve your symptoms, but it won't prolong your life because they're not addressing the cause of your future heart attack. Because plaque can be divided into two types. You have vulnerable plaque or immature plaque, and you have stable plaque or mature plaque. It's the mature plaque, the one that's grown big, that they bypass with the surgery, but the immature plaque or the unstable plaque, that's flat. That doesn't obstruct blood flow, but it's vulnerable to be rupturing, and then you have an acute blockage in that blood vessel, and that's what kills people. And now we go back to vitamin C. That's where vitamin C comes in, because it strengthens the arteries and helps prevent that from happening. Now, Linus Pauling applied for a grant by the National Institute of Health on 2 occasions to study his theory about how vitamin C can help prevent and reverse coronary artery disease, and he was declined on 2 occasions. And that makes me think he's on the right track. Because think of the ramifications if you could prevent coronary artery disease or even reverse it with vitamin C. That would be terrible for the medical industry.
And wonderful for the patient. Vitamin C, vitamin C is so important in so many functions, metabolic functions. When you have surgery and you start to heal, vitamin C is how you put the basement membrane down in whatever tissue is being repaired, and that's the earliest part of repair after surgery or any kind of wound healing. So vitamin C, very, very important and definitely on top of the list. maybe even before NAC.
Well,
So, any questions from the audience?
Yes, I have a question.
Sencha.
My question is simple, that as far as vitamin C and getting your minimum of 2,000 milligrams a day, what is your recommendation for that consumption? Meaning through food, through supplements, and if it's a supplement, what do you particularly recommend? Because there's thousands of them on the shelves, and how do you really?
Great question.
Well, it's a good question, and you're right. There are lots of different types of vitamin C's out there, and it's very difficult to find a natural vitamin C. Most of the vitamin C comes from corn, and most of the corn is genetically modified. So ideally, you want to find a vitamin C that's non-GMO, and sometimes they also have vitamin C from natural products, but you're not going to find 1,000 milligrams in the capsule with that type of vitamin C. But you're not going to get enough vitamin C from diet alone. So you'd have to, supplement. That means reading the labels on these supplements. You just have to, And by the way, I know from experience with patients, a lot of them shop for vitamins based on price. They're not really doing themselves a service. You want to shop based on quality. So when you look at it, you want to, first of all, non-GMO would be the first thing to look at.
I'm a big proponent of vitamin C, and I am a person that takes my own advice. So whenever I get sick, I'll take 4,000 milligrams of vitamin C every 3-4 hours. And generally, I have never taken antibiotics for probably 30 years. When I get a cold or get a problem that I think I should be on an antibiotic, I'll hit the vitamin C, and most of the time I'm through it with a lot less symptoms and much quicker. Vitamin C is, some people can tolerate it. The way you determine about vitamin C, your tolerance is you just take 4,000 when you're sick, 2,000 if you're hesitant, 3,000, 4,000, and you take it 3-4 times a day. And if you develop a little loose stool, then you drop it down maybe 500 milligram. Because loose stool is generally what happens if you get too much vitamin C. Vitamin C also is a very safe vitamin generally because it's water soluble. So you take it and you use it as much as you can, and then it's half-life and then it's gone. So you take it again the next day. So it's a supplement, and it's necessary for healing. So whenever you get surgery, increase your vitamin C, and you'll heal quicker and with better results. Very nice.
I just want to highlight something you just said. It's water soluble, which means it's in and out of your body quickly. So 1-a-day dosing is not enough. You want to split it up to at least twice a day. We test people's vitamin C levels when they're fasting. And more often than not, they're very low because they hadn't taken their vitamin C since the day before. So you definitely have to take it at least twice a day.
Thank you for that. Any other burning questions? Well, I'm just going to go through a few more things about NAC since we're all here. And I'm sure our viewers are very excited and interested in some of these things that you can get over the counter. And so besides, the benefit of NAC is throughout all the cells of the body, it increases what is known as glutathione. And glutathione is probably the most powerful antioxidant that we have. And once again, rust is the loss of electrons, and rust is aging of metal. And oxidation, loss of electrons, is aging in the human being. So anything that promotes antioxidation, such as glutathione, the most potent antioxidant that we produce in our body, is going to be a benefit, not only to the skin, but to all cells that are needing to function properly in a metabolic world controlled by our genes of our body. And then I've given NAC, as I mentioned, in the intensive care unit for the mucolytic benefits and detoxification of the liver and kidney also. That's another benefit. Also, it can improve behavioral health and anxiety lessening, angst and tension lessening with NAC. It's will help lessen abuse and substance cravings. It has been beneficial for some people to get off of opiates and get off of marijuana and cocaine. So there's those benefits. It's also anti-inflammatory, and it is good for the lung. We give NAC called Mucomist, and that is the one that decreases the tension of the mucus, makes it more watery, and able to be expectorated with less force and easier to get out of the body and out of the lung. That material staying in the lung is an inflammatory process to the lung tissue. Getting rid of that is one of the best things you can do for COPD patients, chronic bronchitis, and other lung disorders, chronic lung disorders. So it's a very good medication for people who have a lung disorder, wanting to make less phlegm and get it out of your lungs more easily. And it also can improve brain health. The NAC is part of what makes up glutamate. Glutamate is the most strong and powerful and most concentrated neuroprotective and endocrine and brain neurology medication. So glutamate is increased with, which is the most common neurotransmitter, and increased with NAC, and it increases your glutamate levels in the brain and helps with decreasing stress, anxiety, and it's also shown to improve Parkinson's and have benefits to other Alzheimer's and other diseases, and can slow those processes down. And that's big for a non-pharmacologic nutrient supplement. So I wanted to thank everybody for visiting today on our podcast. And any questions, if you want to dial me, my number is 954-646-0150. I don't mind giving out my number because I give it to all my patients, and I don't mind the calls. And if I can help somebody along their difficult pathway in healthcare, feel free to call me. Thank you very much. From Prestege Wellness, Commercial Boulevard, Fort Lauderdale.